Good afternoon, everyone. Thank you for joining this afternoon's webinar. We're here today to talk about securing patient data and how we can help you in your UK NHS hospital environment. I'm joined today by Chad from Cynerio. Chad, if you want to say hi.
Hi, everyone. Sorry, my mute button got stuck. Good afternoon, everyone.
Thanks, Chad. So Chad will be doing the lion's share of the presenting today. I'm here kind of to host the session. A lot of you will hopefully know or recognise me. I'm Andy Sherritt from ITHealth. ITHealth are Cynerio's UK partner, basically. So everything that Cynerio does in the UK is kind of delivered and supported by ITHealth, and we've got a pretty good level of coverage already. We've already got around about 40 NHS organisations signed up with Cynerio and implemented. So can actually see there's a few existing Cynerio customers on the call already. So yeah, thanks very much for being part of Cynerio and for joining today's webinar. There are still people joining, so as you're joining, welcome. We'll kind of continue going along. So yeah, Chad's got the agenda on the screen. So as I said, we're here predominantly to talk about patient data and how Cynerio can help you secure that on your NHS systems. So we'll look at kind of the overall picture, why this is a pressure point, and essentially how we can help you. And Chad's going to lead on that. As we go through, I would be very grateful if you could post your questions in the chat section. I'll be monitoring those whilst Chad's presenting, so do feel free to post them as we go through. It's actually better to do it that way than to save them up for the end. I'll be monitoring those and we'll pose them to Chad at the appropriate time, but certainly there will be time for questions at the end. I guess just in addition to what's on the screen there in terms of the agenda, just for absolute clarity, appreciate there's some existing Cynerio customers on the call. This patient data security module is a brand new module which Cynerio have just released. So it's something which is new both for the existing Cynerio customers and for those of you who haven't yet joined Cynerio yet. Chad will explain kind of how it works, but essentially it sits alongside the existing platform and focuses in on assets which are exposing EPHI, basically. So Chad, I won't steal any more of your thunder. I guess just finally from me, additional housekeeping points. I've mentioned the questions. Also, we will be recording the session as ever, so you'll get a copy of this recording, both to those of you that have joined and those of you who might be watching this in delay who won't be able to join. We'll send a copy through by email. And also importantly, there's a survey at the end, so we are very grateful for your feedback. The survey responses that you'll see at the end help us shape our future content for webinars, so please do fill that in. Okay, I think that's my stuff out of the way. Chad, I'll let you crack on.
Well, thanks, Andy, and thanks to everyone for joining. As Andy mentioned, please ask questions as we go through. I did this presentation a few weeks ago stateside. We had like 15 questions. It made for a great session. So if you have something that comes to mind, it probably is a question someone else wants to ask as well. So get it out there. We're going to take quite a journey today. Before we start talking about this new product, I want to go into the background of why the product even exists, because it's never good to provide solutions without reasons that you need them. So we'll start a little bit today talking about the state of patient data security, why we're under such attack globally, particularly in the UK, US, and a few other countries. We'll cover some common exposure points, and then we will hit on some bonus guidance on top of what we're going to show today around what else you can be doing to help secure healthcare. There's some really good guidance that's come out recently that I want to make sure you're at least aware of. So jumping right into things, the challenges healthcare face are becoming overwhelming. It can be very easy to think, hey, the hospital down the road from me, the trust down the road from me just got hit, they're unlucky. And the reality is cyber attackers have found a very profitable source of data in healthcare. So right now, if we look globally, there's a cyber attack roughly every 7 minutes across the world. The UK has experienced 9 successful cyber instances from 2021 to 2023. That number is going up, as we'll see as we go through, which puts the UK in an okay spot, not great, but okay within the EU and its neighbors, with the number 8 most instances. I think it was Italy, Spain, and Germany, if I remember correctly, had the most instances in that time frame. As we dive a little bit deeper, we start to realize that half of hospitals or half those attacks, excuse me, were hospitals within that time frame. So you get clinics, you get providers, et cetera, but hospitals are still a clear focus of attack. And the good news is if we start taking a look at how we can improve protections, there are technologies out there that can help. Things like microsegmentation, which is one of the core components of our platform, have been shown in other industries to effectively prevent the spread of attacks. And if we were to successfully implement them in healthcare environments, which is a heavy lift in some cases, they could cut all these numbers down. But at the end of the day, attackers have found really, really vulnerable environments in healthcare and are continuing to hit them quite hard. And if we go back to WannaCry, which I think almost everyone here is familiar with, we realize that's the opening of Pandora's box. At the time, the NHS was hit incredibly hard. It was a worldwide attack, but the NHS was particularly susceptible to the attack. So widespread outages, the estimated cost for that attack in 2017 was 92 million pounds. And at the time, the thought was, hopefully this is the worst it gets. Hopefully this is just an outlier, not a widespread issue. And we all know that unfortunately isn't the case. This was just the beginning of a long stream of attacks. If we take a little trip from the UK in 2021, over in Ireland, health service executive had 80% of their IT systems encrypted as well, and took them roughly 5 months to recover to some operational state. The estimated cost there was £500 million with a B pounds. So really, really costly events. But if we start to look more recently, we start to see that there were 215 such events in the last couple of years throughout the EU and neighboring countries. And if we really zero in on UK, we have places like Barts Health and University of Manchester, where terabytes of data were stolen and millions of patient records were exposed back in 2023. And with the magic of everything being at our fingertips now, we can actually start to see what's happening today, last week, last month. And we realize that places like Dumfries and Galway, and apologies for everything I mispronounce and mistype today, just bear with me. But we can see that they've had 3 terabytes of patient data released. That is an ongoing data breach that we're still learning more and more about. And if we look, over where I am stateside, which can give a lot of information to the global healthcare community, we have places like Change Healthcare, which is a payment processing provider, where they had a $22 million ransom that they paid to try to get back online. And the cost from that attack are now measured in the tens of billions of dollars, and it's ongoing. And we're seeing the lack of payments are actually being correlated directly to poor patient care. Effectively, you don't have money to keep your operations going. You cannot care for patients, is what we're seeing here. We also know that in the US, we have very strict regulations specifically around reporting data breaches. We have other issues with regulations, but with data breaches, we do have laws around them. And we saw that last year, 1 in 3 US patients had their data exposed. And funnily enough, I'm one of the 1 in 3 there. My records were exposed in a Christmas Eve hack in the hospital system that I use for care. So the reality is this is a focused effort on the global healthcare system because patient data is so incredibly valuable. Now, by definition, Pandora's box is a whole lot of awfulness that has some bright side at the end. So we do have some bright sides coming out of all these breaches. First is because we're seeing so many breaches that are having so much impact, there is increased research and development. And I'll talk about some of the research that we've been doing with this new product I'll talk about a little bit later on. But globally, there is an increased amount of focus on how can we better tailor security tools to the specific needs of healthcare environments. So we're seeing a great uptick in that. So that's one silver lining. We're also seeing more resources and training. Now, don't mistake me. It doesn't mean that every hospital has all the resources and skills and training they need. I've never heard a hospital say, yeah, we have plenty. But they have more than they did 2, 3, 4 years ago. And so as we're getting more resources to help protect us against these attacks, things are slowly getting better. And then finally, we're also seeing improved guidance, right? If you think of the hospital, the trust that you go to, the IT staff in all likelihood is relatively small. The hospital down the road from me has an IT staff of like 2 people. And there's no way those two people can go and try to stop the attacks coming from Russia, China, other places. But what we can do is start to improve the guidance that they work off so they're not trying to create everything from scratch. So we have improved guidance that I'll talk about a little bit later on that is helping us understand how we should prioritize efforts, what technologies we should use, and how we should use them. So there is some bright side there. And of course, to understand why we need to protect patient data, we need to understand why we're under attack. And the answer is pretty easy. It's money, right? Kind of in our lizard brains, we immediately jump to, oh no, the hackers are going to come in and they're going to try to hurt me in some way, right? They're going to try to up the dosage on my IV pump. They're going to try to kill me, whatever the case may be, to put it bluntly. The reality is that's not why hackers are hacking, right? If you're a public figure, if you're a politician, maybe you have a bullseye on you. But in reality, hackers are in it for the money. They know that if they have credit card data that they steal online, it costs about £2 that they can sell it for on the black market. That credit card data is very quickly canceled, so they can't do a lot of fraud. They can't make a lot of money off that. But healthcare records are incredibly difficult to cancel. They're incredibly easy to commit fraud with relative to other efforts. And so on the black market, we see that patient data is worth, roughly 25 times more per record than credit card costs. And as we saw before, when you're getting these records millions at a time and terabytes of data at a time, that becomes incredibly lucrative on the black market, to the point where even the ransomware gangs that are getting busted up and getting arrested, they often leave the technology behind. They often leave instructions behind for their followers to go and pick up where they left off. So there is a massive amount of money at stake, and nearly all of these attacks are financially driven. And the reason these attacks happen can be broken down, at least at a high level, to 3 levels. One is the industry has traditionally underinvested, right? We as a healthcare system have a primary focus not of driving revenue, like most security leaders, but of caring for patients, right? And therefore, our spend tends to go towards patient care, which is exactly what we should be doing. But we've overcorrected towards patients and have not put enough towards security as we've adopted new technologies that we've put on board. So we do have challenges at the industry level. We also have challenges at the institution level. We did a study at one point where we asked who was the right owner of cybersecurity, who should be responsible for securing medical devices, for example. And nearly 10% of the respondents said it should be nurses, right? Not CISOs or CIOs or executives. Nurses should be doing this. And clearly, that's not the right answer, right? Nurses should be providing care and saving patients' lives, not worrying about the configuration of an IV pump to prevent it from being hacked. So we have to make sure that institutionally we know who takes responsibility for this, who makes sure that security is getting implemented correctly. And then finally, if we look down at the technology level, we've onboarded thousands of devices in many cases that provide improved care. That's why we onboard. It's why we have CT machines that are connected. It's why I can personally get an X-ray of my knee in New England and have it read in maybe the Philippines and have that radiologist report within hours rather than days or weeks. But by putting those online and not securing those devices and holding manufacturers to a higher standard, we're also putting our environments at risk. And all of that is not only putting patients at risk, but it's putting their data at risk as well. So if you do want to read more about that, we do have a white paper. I'm happy to pass it along, or you can go to our website, cynerio.com. We dive much deeper into all those topics. I just wanted to make sure you knew those resources were available. But now that we've defined what the actual problem is, we're going to dive a little bit deeper into where this problem exists, where specifically attackers are focusing on healthcare systems to identify points of exposed data and then steal that data. And the first place I always like to talk about is PACS systems, right? Imaging systems where the whole goal of these systems is to take medical images, medical records, and share them with the people that need them at the time they need them. My X-ray example, for example. The problem with PACS is that they're notoriously insecure. There are reports of over 2 billion, with a B, records being exposed over the last 10 years by PACS systems. Some estimate it's higher. And one of the reasons this happens is because, again, they're focused on sharing data, not necessarily securing it. One example that we found was kind of scary in its simplicity. We found a PACS system where, while looking through the user manual, there was a hard-coded URL in one of the screenshots where we could actually take that URL, change some parameters, put it in a web browser, and get access, unauthenticated admin level access to all the data in that PAC system. It was effectively a magic URL that gave us full admin protections that exposed EPHI, PII, et cetera. And this was a common, well-known PAC system. And of course, we work with the manufacturer, we've got that secure, but this is the level of hacking that we're trying to protect against. This is not advanced hacking in a lot of cases. It is simply reading the manual and being a little bit clever with what you see to better breach the environments. Next, we've also seen that systems like cardiovascular information systems will communicate over unorthodox ports. The thought being, instead of going over port 80 or 8080 or 443, whatever port you're using, if you go to a different non-standard port, hackers would never think to look there. And of course, that can be further from the truth. Hackers will just run a port scanner, see what's going back and forth, and monitor those ports as needed. And so in this CVIS case, excuse me, we found that if you just scanned the ports, found the open ports, and then did some basic communication with them, again, you got full access to the CVIS system without any credentials. Now, the good news is these systems tend to hold less patient data and cache that data for shorter periods of time, but it still puts patient data at risk. And with some very rudimentary, very basic attack techniques, we were able to capture hundreds and thousands of records in this case. Next, I think most people that have been in a hospital recently are familiar with whiteboards near nursing stations where you're tracking patients and the care they need. These have started to become smart whiteboards. So instead of having a physical whiteboard where you're writing on it with a marker, these are now smart TVs that have the web portal often up on them. We found that in one case, the web portal was properly secured. You had to log in, you had to make sure you went through all the right authentication steps. But there was also a mobile interface that assumed access. It assumed that if you knew the mobile interface existed on a certain URL with certain endpoints, that you should just magically have access to it. And in this case, not only was the patient data exposed on the screen put at risk, but this system cached several years worth of data as well. And that cached data was able to be harvested by our research team. Obviously, we didn't sell it. We didn't sell it in any of these cases. We secure these environments, but as we were doing research, we were able to harvest it and show people exactly where the data was exposed and where it needed to be secured. And then finally, and this is the most scary for, I think, just about anyone on the call, a lot of newborns will get an RTLS bracelet, effectively a bracelet that their parents also get to make sure that you have the right baby with the right parents. And in this case, in the US, this is not an FDA regulated device because it's not providing care. And so it doesn't fall into any of the guidelines or regulations on how to properly secure devices. And that's similar worldwide, where this device, the device itself was fine, but the backend server was susceptible to attack through direct telnet access. You could just telnet into it, which, if you're not familiar, is a very straightforward protocol that you learn in like IT security day number 2 in your training. And by telnetting in, not only could we see all the data and steal all the data, but we could also change and delete the data. And this is where things get really scary, because if you have people that may want to kidnap a newborn, which we all know unfortunately happens, and they have access, they could potentially change the data in there to confuse the issue even more, either delete it or potentially say the bracelet they're wearing or have stolen should be linked to that newborn. So at the end of the day, these are systems that we're using every single day, and there's many more of them, but we're using them every day. And as we use them, we're using them for good, but also errantly exposing patient data at volumes that just aren't acceptable anymore. And this is what we're trying to protect against. And so as our team started going through and doing research around those systems and others, we started trying to figure out how can we best protect this, right? Is it automated protection? Is it discovery? Is it working with folks? And over the last 2 years, we've been working on this research in this product group and asking ourselves where we start. And what we realize is, much like all the other protections we've put in place, all these devices, whether they be IT, IoT, IOMT, they're sitting in the hospital and they're communicating back and forth, and they're communicating in ways that's rather open. The data isn't encrypted. It flows freely between them. It's one of the reasons ransomware attacks, for example, can spread is because of the free data flow. But the EPHI is also able to spread really, really easily, or be extracted, I should say, really easily if you know how to go after it. But that free flow of data also gives us a lot of the information we need to start better securing these environments, right? Because the data is not encrypted, because it's just kind of wide open, we can do analysis and start to lock these systems down really quickly. But we also have challenges with the devices that we have there and how we secure them, particularly compared to other industries. First of all, a lot of devices we see environments cannot have endpoint protections installed on them. Yes, IT workstations still can, but IV pumps, CT machines, things like that, you can't put endpoint protections on them in many cases. The devices are very healthcare specific, meaning the environments they work in and how they operate have to be specific. You cannot have these devices restarting simply because of a security error. That's just not acceptable. It puts patients at risk. So, which means we have to prioritize safety. Again, it's an additional challenge we see in healthcare versus, say, the finance industry, where safety isn't nearly as high a priority because they might lose a couple dollars if a system restarts, but it's securing the system. We can't have those systems restarting or crashing. And we also know that in healthcare, there's just not enough people to do the work. So we have to prioritize the efforts in this new product set to make sure that the guidance we're giving you is simple, direct, and impactful. And so what we decided to do was, based on a lot of our other technologies as well, is we focus on the network traffic. We realized that all these systems are openly communicating, that traffic is freely flowing. But if we start analyzing that traffic in a way that protects patient data, that doesn't expose it, we can start to see what data is going where, right? Is the data going to a place it should be going, or is it going to someone that's exfiltrating large data sets? And as we got more and more into this, we identified ways to actually identify the exposure points before data was being stolen from them. So we could be proactive in our protections rather than having to be reactive, releasing a press release that, hey, we were breached, and going from there. And so when we started to look at that data, we realized it's going to tell us a lot of information about what we need to protect. The lack of encryption I mentioned earlier is very valuable because we can dive a little bit deeper into the packets and understand what data is flowing. And the common exposure points that we saw earlier, the PAC systems cardiology, those continue to be the leaders, but we're also seeing a drastic increase in the number of APIs and interfaces that are naturally built into systems, not locked down by default, and starting to expose data as well. So in many cases, we saw systems were deployed, they had APIs that were exposed that people didn't even know about, and we're just sitting there waiting to transfer data because that's what they were built to do. We also can go in and look at areas for improper authentication. We can see the flow of data, right? So if it's flowing from system to system, if it's flowing from an IV pump to a nurse's station, for example, that's perfectly fine. If it's flowing from a nurse's station to Russia, though, that's probably something we need to look a little bit into. And as we gather all this information, we realized we could build very helpful dashboards that will show you the systems you have, how they're exposing that data, and what data is being exposed. But it's not just about the systems that we're finding. It's also about making sure that we can provide clear guidance on what to do with those insecure systems. And again, because network traffic tells us just about everything we need to know to properly secure an environment, we realized we could identify the systems IPs rather easily. So we can tell you exactly what the systems are and where they are, figure out where clients are interacting with them, seeing how users are interacting with them, right? So for example, if you have the same credentials logging in within a minute of each other, 200 miles apart, probably not a good use case there. People are probably using credentials when they shouldn't be. So we could start to see some of those misuses. And then we can see things like insecure protocols being used or the risk and severity of these issues. And so we started to collect all this data, but as you might imagine, that amount of data can be rather overwhelming, right? There's a lot there, there's a lot to wade through. As we were doing more and more research, though, we started to realize there were common patterns in how this data is being processed, passed, and most importantly, how it can be protected. So not only can we detect all this data and give you all the bad news associated with it, but we can also automate and then validate with our Cynerio Live team the remediation and patch guidance to help secure these systems as well. So we've designed this really cool system where we see all the bad stuff around EPHI and where it's exposed, but also have created ways to help you remediate it very often in short order, right? There's been cases where we've seen thousands of records exposed, and a simple credential change will immediately secure that environment or secure that part of the environment. So it's a really, really good way to go ahead and show the problem and then show a simple solution in many cases. And so what I want to show you now is a little bit of what the actual product looks like. You've seen some screenshots up to here, but I want to give you a little bit of a taste of exactly what the user experience looks like so you can see the data and how you can protect it. And again, if you do have questions, we'll get to them here in just a few minutes at the end. So the first thing that our product does, and you saw this screenshot a little bit earlier, is we go in and we identify as many systems as possible that are transferring patient data in some kind of insecure way. So in this case, you can see we have a GE Muse system. We have a couple other PACS and other systems that are out there. And if you kind of squint your eyes and look really close, you can see that not only do we give you the system name and the level of vulnerabilities we're seeing within it, but we're giving you the very basic information you need to start identifying that system. The services it uses, the volume and types of EPHI it's transferring, and then the impact it has to patient confidentiality, safety, and disruption. So again, this is not quite enough to go ahead and start securing the environment, but it's a great dashboard to understand the systems you have that are exposing data. It's that high-level snapshot that allows us then to drill deeper into the details on a system-by-system basis. So from a user experience, if we were to go ahead and look at the GE Muse system, you see we can dive in and it gets a lot more clearer about the details of the system. It gives us the host name, the IP address, who the vendor is, because in some cases you do have to engage with the vendor to get these systems secure, as well as other information like the operating system it's running. So we start to get a really good fingerprint of what this system is running and how it's exposing it. We also start to get more detail into how the system is interacting with other machines, with other people, with hackers in some cases. So we see the services count, the number of clients, and the number of data feeds that are out there, which is good because if you know you have one client with one data feed, you can zero in on that. In this case, it's kind of a little bit broader, and we need to figure out exactly where the issues lie. We can also see that because EPHI is almost always transferred in an unencrypted way, at least within the walls of a hospital, by doing analysis of those packets, we can start to tell you exactly what types of detail that EPHI holds. In this case, it's just patient name and ID. So bad if those are exposed, but it's not the full set of patient data you might expect from some other systems. And then finally, at the bottom right, we can see a high-level overview of the risks in the system. We can see there's one critical unsupported OS in this case, and then a bunch of high issues that we need to get to. As we navigate across the right here, we can dive into these 6 services a little bit better. And again, you can see only one of these 6 is encrypted by default, which is absolutely terrifying, but on average is more than what we see from other systems. Somewhere between 3 to 5% are typically encrypted. So this is somehow a leader, which is terrifying to think about. But we can also start to look at the services, the number of clients it has, the amount of EPHI. So here you start to see we get more granular in the number of records, right? So the cardiograph service has 8 records per day, whereas the one running on 9240, the TCP client, is 2,500 per day. So we get to see a little bit more about these services and can drill down into them to identify where we need to secure them. That service running on 9240 is probably the one we'd start with here. We can also see who's actually accessing this data, the clients that are connected to the system, consuming the data in some way. And as you might expect, there's a bunch of cardiograph machines that are connected, and in this case, printers and managed PCs. So at a high level, this is a decent inventory. You'd expect this level of insight and these types of devices connecting to that system. But we can also dive deeper into the data feed and see what data is being exposed. So in this case, we see 3 endpoints of the 11 that we have listed. And if we look down to the third one there, we see that that's a DLL that's exposing, again, both patient name and patient ID. And we could dive a little bit into port 88 in that case to investigate the issues. And then finally, most importantly, is the risk we identify. This is where the rubber really hits the road. This is where we go in. In this case, we've identified a legacy OS, and we give you mitigation recommendations. So in this case, this is an end-of-life OS. Because of the system, the GE Muse system here, it's unlikely that we're going to pay to replace that entire system just for the sake of an OS. This OS doesn't have patches available, but we can mitigate it in this case with segmentation, right? And sometimes it's a change of credentials, sometimes it's segmentation, sometimes it's rip and replace it. It is all context dependent and situationally dependent. But at the end of the day, these issues that we found with the system are incredibly achievable in a relatively short amount of time. So the whole goal of this overview is to provide you with the insight that is automated. Often this is found within a matter of days in install. Often these devices, when we do these analysis, we go in, we deploy, we're able to address most of the issues within a few weeks, probably more realistically a few months. And then it turns into very much a business as usual, identifying those new systems being put on board and making sure we're securing those correctly. So if you do want to learn more, you can reach out to Andy or myself. My email address is chad.holmes@cynerio.com. Again, the name of the product is Patient Data Security. The entire goal is to identify areas of systems, exposing your patient data and ways to better secure that, so we're not leaking data and making hackers millionaires like we've seen over the last few years. Now, before we get to Q&A, keep those questions coming in. There are a couple more pieces of evolving guidance I want to throw you. Sorry for the abrupt change, but these are areas of guidance that I think are particularly important for the UK and the US, so I try to share them whenever possible because the guidance overlap and actually complement each other really well. So there's three things that everyone on this call should be aware of if you're not already. One is the NHS Digital Data Security and Protection Toolkit. This is effectively doing self-audits and documenting with evidence items the assets you have to properly implement security. I think we can all agree DSPT is not the be-all end-all, but it is a very good first step in improving security practices within trusts. What we're seeing, though, is that the National Cybersecurity Center has recently launched their cyber assessment framework, the CAF. And the CAF is being seen as a great predecessor to DSPT. It is the next set of recommended activities that you should be taking to secure your environments. So for you, those of you working in the UK, I highly recommend becoming familiar with these two if you're not already. Probably are. The third that I want to make sure everyone aware of is in the US, Health and Human Services, their HPH cybersecurity performance goals. Effectively, this is a group of two groups of 10 goals, the essential goals, the very basic things everyone should be doing, and the enhanced goals, the things you should start looking at as soon as possible. And as an example, the essential goals are things like email security, encrypting your data, very, very basic IT activities, where the enhanced goals are those forward-looking things like microsegmentation, automated inventory of assets, interacting with third parties, things like that. So these are two very good checklists of what you absolutely should be doing today and what you should be doing in the future. They're intended for the US healthcare system, but they can be used in almost any modern healthcare system that is highly connected. So sorry for the abrupt departure there, but I think it's really important to point out resources that are available to anyone. And I think you all should take a look at those and let me know if you have questions about them. So with that, Andy, I will turn it over to you for any questions that have come in and try my best to answer them.
Yeah, thank you, Chad. Hope that was useful for everyone. It's obviously kind of a bit of a newer topic. As far as IT health are concerned, we've obviously done lots of work over the years around securing patient data, but actually being able to identify those devices on the network which are hosting it and ways which you can then lock down those devices using the Cynerio tool is, I think, extremely powerful. So yeah, thanks, Chad. A few questions have come in already. There is plenty of time left, so if any of you do have some questions, please do still post them. I'll start with this one. So it's kind of a why do we need it sort of thing. So they've already got various tools. Obviously, they've got Landsweeper, IT Health Dashboard, and Microsoft tooling. They've got a SOC as well. So why can't they use those existing tools, and why is Cynerio needed specifically to address this problem?
Yeah, so the smart Alex side of me wants to say because they're not working as they should, which isn't the exact right answer. So effectively, those tools are developed mostly for traditional IT systems, workstations, servers, etc. They're not necessarily looking for the modern attacks that attackers are taking advantage of. So think of it not as, hey, in 2017, this was the level of IT protection that was a known good. You have to keep evolving those protections over time, particularly as attackers are showing you exactly where they're attacking. So think of this not as a replacement for those tools, but supplementing the technologies to help improve protections.
Yeah, that makes sense. And I think this one probably follows that one the best. So you mentioned around how you can secure systems. Could you just explain that a bit more? So if you do find a device which is kind of transmitting PID in an unsecure way, how quickly can you lock that down using the Cynerio platform?
Yeah, and this is something that we kicked around a little bit, which is, do we want to automate the protections or do we want to inform and support our customers? And the reality is most healthcare environments we work in do not want automated protections deployed, right? There's a natural and very reasonable fear of, if you're messing with my environment, my servers, whatever, it could impact patient care, which is entirely reasonable. So we've taken an alternative approach, which is we want to provide you as much clear, prioritized, actionable information as possible, and then give you the support through our Cynerio Live research team and our customer success teams to make sure that those protections are being implemented. So again, as an example, if you have an exposed endpoint which is transmitting data in an unauthenticated way, we'll identify that and say, hey, you should lock it down by implementing this setting that requires authentication of the user in this way, whether it's using a key, whether it's using credentials, et cetera. And so not only will we provide you the guidance of what's wrong, what you need to do, but then we also have, again, our customer success team and our Cynerio Live research team to answer any questions and walk you through those steps. The reality is the work itself typically is not that difficult. It's finding the time to do it. In the case where we've seen active attacks kind of adjacent to this product, we spend more time getting people on the phone and alerting them of the attack than we do actually resolving the issues that are causing it. So our whole goal is to support you through that fix rather than do it for you, just because the nature of healthcare environments.
Yeah, that makes sense. Thank you. Quite a specific question here, which I think is a good one and worth answering. So thank you, Kem. Can we import data into eQuip and vice versa? I can actually answer that one for you because we've got multiple customers doing that, Kem. So yeah, obviously you guys have got Cynerio. If you've got eQuip as well, which I wasn't aware of, then absolutely we can talk to you. That's a native integration. So assets can go both. Asset information can go from Cynerio into eQuip to populate that CMMS database, or vice versa. If there's information within eQuip that you'd like to see within the Cynerio platform, it can flow both ways. So that's a big yes. Please talk to us about that after the call. And final question for now. Obviously, if there's any more, please post them. But the final one for now is. It's quite a good one. Thank you, Andy. Given the increasing scale, diversity, and severity of the modern attack surface, how do you see IT Health Dashboard and Cynerio helping IT prioritize busy IT service departments' workloads? So I guess I should probably have a crack at that first,
Sure.
given that you've referred to IT Health Dashboard within the question. So yeah, I think yeah, I might want to spend a bit of time thinking a very detailed response to that question. But I think first and foremost, the ability to understand your assets. So the combination of IT Health Dashboard and Cynerio, and actually the integration of the two, so that you can actually see all assets in a single view, I think that's first and foremost very powerful, and that will help IT departments prioritize, because that complete visibility of everything that's connected to an NHS network is quite unique. Obviously, lots of other vendors talk about everything in one place, but I think we've proven that with the combination of IT Health Dashboard and the Cynerio, the inventory management side of things is extremely accurate and allows you to really get a solid understanding of everything that's connected within your NHS network. So that's the essential building block to everything else that we'll talk about. So yeah, that would be my starting point, Andy, is actually that initial visibility of everything that you've got, so that you can then start to prioritize from there, basically. Chad, anything to add to that?
Yeah, I'll jump on that a little bit more, which at a higher level, a lot of this is not about the technology, right? We integrate great with IT Health. Most systems are built to operate behind a single pane of glass. So whatever you want that single pane of glass or panes of glass to be is certainly achievable, right? So I think that part is pretty easy to address. The bigger issue, though, is actually optimizing your team, right? You have 100 people's worth of work in a dozen people to do it, or whatever those numbers are. And we have to make sure that all those efforts are optimized in some way. So one, the single pane of glass, one central location to see everything helps, but also making sure we're doing things like properly prioritizing and rating risk, using things like EPSS and CVSS to make sure that you're not focusing on low priority, low risk results over high priority, high risk findings. So making sure that we can optimize the team you have with the tools you have to make them better is really critical. And of course, that's a top focus for both the IT Health team and the Cynerio team. We can certainly help with.
Yeah, absolutely. Yeah, thanks for the questions, everyone. And thank you, Chad, for another excellent presentation. I think we're done for the questions. The only thing that's left is really for me to thank everyone for joining. We do appreciate your time. I hope that was time well spent. We, again, would appreciate your feedback in any way, but certainly when you click to end the webinar, please do just fill in a couple of questions that are there so we can help our marketing team decide on how we structure some of these in the future. Otherwise, we'll look forward to speaking to you soon. Thank you, Chad.
Thank you, everyone.
Bye for now.